The spectacle that is visual arts is best appreciated with a clear vision. But what if you have poor eyesight?
5 practical tips on how one can take care of their eyes. No? First things first, have yourself a preventive checkup. Okay, meaning even if you don't feel anything, have yourself seen by a properly licensed ophthalmologist who will be able to guide you with respect to how healthy your eyes are and what needs to be done to protect or prevent further damage if there is any particular disease which is happening. Number 2, wear protective eyewear whenever you engage in contact sports, or if you go ahead and during the holidays, if you use materials to celebrate, make sure that you wear protective eye goggles. No? Number 3, try to avoid rubbing your eyes because rubbing actually does several things. No? Number 1, it exposes the eye and the eyelids to potential microbes, no? Or non-clean materials which may potentially irritate and infect the eye. So we have basically 3. Number 4 is to wear appropriate reading glasses or distance glasses or computer glasses depending on the actual requirement of your vision if you have a refractive error. And probably finally is to always keep your hands clean whenever you go ahead and touch your eyes, and at the first sign of anything which is out of the ordinary, to have yourself seen by someone who knows what they're doing.
Well, nowadays, such a condition need not be a cause for despair. The advancement in the field of eye care is such that many visual impairments can now be successfully resolved, some even permanently. The Eye Republic is a clinic that specializes in the latest and most advanced treatments and procedures that address some of the more common vision problems, ranging from cataracts to glaucoma to near and far-sightedness, among others.
LASIK is a form of corrective laser surgery for people who would like to get rid of their eyeglasses. This is an acronym for laser-assisted in situ keratomidrosis. Basically, it's a laser procedure that we do on the cornea for those qualified individuals aged 16 even up to late 50s who have this desire to get rid of their prescription glasses for distance, near, and even for astigmatism. What's the difference between LASIK and PRK? Nowadays, for refractive laser surgery, the most common would be LASIK, and the next procedure would be advanced surface ablation. For advanced surface ablation or PRK, it has other nicknames such as EpiLASIK, LASEK, or epithelial brush assisted PRK. What we actually do is we scrape off the epithelium or the anterior surface of the eyeball or the cornea and then zap it straight with laser. We place a protective bandage contact lens for a couple of days and then take it off and allow natural healing to proceed. For LASIK, a super blade is used to make a very, very thin cut in front of the cornea. Okay, let me take this out to illustrate further. This is the cornea. We make a thin flap. We zap it with laser. After the laser has completed zapping into the cornea and ablating it properly, we replace the flap back. Pretty much like when you would open a book, read it, and then close the flap of the book. So that's what LASIK is. LASIK is the most popular refractive procedure primarily because it gives instant gratification. The results of vision improvement is so much faster with respect to being achieved as compared to PRK. You have 4 major refractive errors. 1 would be nearsightedness or myopia. 2 would be hyperopia or farsightedness. 3 would be astigmatism. And 4 would be presbyopia. For nearsightedness or myopia, light does not fall on the retina. It falls in front of the retina. So the focus of light comes earlier before the retina. This can happen when the refractive power of your cornea or your lens is stronger, therefore making light focus nearer, or if the axial length of the eyeball is longer than that which is normal. Okay? So these people would be able to see things up close even without glasses, okay? But distance would be a blur to them. Next would be hyperopia or farsightedness. Light does not fall on the retina, it falls beyond the retina because your eyeball is very small or your cornea and lens is very weak. Okay? So we can correct this with laser surgery by reshaping your cornea to move that focus of light on the retina. Now, there are instances that individuals would have errors of refraction called astigmatism. Astigmatism is when the eyeball or the cornea of the eyeball is not a perfect sphere. Imagine seeing a basketball which is equal in curvature all around. Imagine a football which has one area which is longer and one area which is shorter, having an area which is steep and having an area which is flat. Okay? If you have a football, that is a good representation of astigmatism. The curvature of the cornea is not equal at all directions. One area is steeper, one area is flatter. This would give you, or the individual who has astigmatism, blurred vision for distance and for near. Fourth most common refractive error is called presbyopia. Presbyopia is when an individual has no refractive error for distance, is able to read for near up until the age of 40. Once they reach the age of 40, their reading accommodative power disappears. That's when you go ahead and buy reading glasses and wear them for you to be able to read.
Just as eyes are the windows to our soul, so are the windows to the world around us, a world of natural beauty and beautiful nature, painted in the colors of our own choice, on a canvas that we call life, and displayed in a gallery that we call humanity.